My name is Victoria Dolce, and I'm Associate Director of International Student Support and Engagement at the University of Florida International Center. In this video, we want to briefly cover the topics of healthcare in the U.S., resources available to you on UF campus, health insurance requirements, and what to expect when paying your medical bills. To begin, healthcare in the U.S. is widely available. This means that the system is huge, and you can find hospitals and clinics everywhere. As a result, that means the system is very complicated. You will need help to navigate it, and that's okay. You may have heard that healthcare is very expensive here, and generally, yes, that is true. All care, including emergencies and medicines, is paid for by you or your insurance company. This means we have a privatized system in the U.S. For international students, the government does not pay for healthcare. The system is also decentralized. This means that different doctors' offices are not necessarily communicating with each other. This means that your healthcare is your responsibility. Please keep in mind that your health is very important, and it's your responsibility to understand the system in the U.S. to avoid any delays in your care. There are many resources available, and we want to empower you to be your own advocate. To start, we need to make sure we understand some vocabulary. For example, the word hospital. If you are going to the hospital, this means you need immediate medical care that cannot wait. We also call this the emergency room. This should only be for extreme injuries or illness, such as prolonged bleeding, unconsciousness, difficulty breathing, chest pain, broken bones, paralysis, blindness, severe allergic reaction, animal bite, or poisoning. If you cannot get yourself to the hospital safely, you can call 911 and you will be transported in an ambulance. An ambulance takes you to the hospital only. You can call 911 and emergency medical services will come to you. Please note that you are not required to go with them to the hospital. You can refuse the ambulance ride. If you do take the ambulance to the hospital, know that your insurance will likely not pay for it. However, if you can wait and it's not an emergency, you can go to a clinic. This is different than a hospital because it's for small injuries or common illness. We also call this an urgent care center. These are facilities off campus that you can use without an appointment when the student healthcare center is closed. Clinics are much cheaper, faster, and more convenient than a hospital. Take a look at some of the price differences here. As you can see, the emergency room is a very expensive place to go for medical care. It should only be for life-threatening medical emergencies. However, you are the best judge of how you are feeling and where it is best to seek treatment. Please do not hesitate to visit a provider if you need medical attention. So let's talk about some resources on campus. I mentioned the Student Healthcare Center. This is a clinic on campus, also called the infirmary. In general, students seeking care from a medical provider will be given the next available appointment time. However, for your first visit, that appointment may take a few weeks to become available, so please keep that in mind. Students who feel their concern is urgent may ask to speak to a nurse for same-day advice. After-hours phone consultation services are also available, and the on-call medical provider can help you determine if you should seek medical treatment from a community facility right away, or if you can wait until regular business hours to be seen at the Student Healthcare Center. Your mental health is also very important. For example, international students may experience difficulty adjusting to a new culture, a new schedule, or understanding new social norms and practices. The Counseling and Wellness Center helps UF students cultivate their mental health and well-being in support of their personal, educational, and career development. Services include short-term counseling, group and couples therapy, crisis support, outreach, referrals, self-care, and more. You can visit their website using this QR code to make an appointment for a brief consultation. The Disability Resource Center is also available to act as a resource for students with physical, learning, sensory, or psychological disabilities. The DRC provides support for reasonable accommodations to give equal access to academic courses, programs, and activities. You can visit their website using this QR code to make an inquiry appointment. And if you have a mobility-related disability, whether permanent or temporary, Gator Lift is a free paratransit service available to students, faculty, and staff. You can request a ride on their website using the QR code here. Next, we will move on to the topic of health insurance. Here at the University of Florida, preserving our students' health and wellness is paramount. There are times when students' health or well-being, access to health services, or payment for health care can hinder them from achieving their academic goals. Therefore, the university requires insurance in order to remove as many obstacles as possible for our students to reach graduation. All international students are required to purchase the student health insurance plan offered by United Healthcare Student Resources unless proof of comparable coverage from a different company is provided. Keep in mind that proof of comparable coverage must be provided annually through the online waiver system. Also know that travel insurance is not accepted, and just because you pay for health insurance does not always mean that it will pay for all of your medical care. We'll talk about medical bills later. Enrollment may be arranged within the first 30 days of a semester. The policy year begins on August 16th and terminates on August 15th the next year. There are 2 enrollment options. You can call United Healthcare Student Resources directly or visit their website, where you can also view full plan details and prices. Or you can reach out to the local insurance agent and you'll be able to ask any specific coverage questions at that time as well. If you do not want to purchase the student health insurance plan, you may be able to use other health insurance that meets the university requirements. To do so, you must submit a waiver through the Health Compliance Student Self-Service Portal. Remember, that has to be done every year by the fee payment deadline. You can submit your waiver using the QR code here. If you are a graduate student, you may have heard about GATORGRADCARE. You may be eligible for this plan if you are employed with an assistantship. Please contact them to check your status and learn more about your health plan benefits. Being your own healthcare advocate means your health insurance is your responsibility. Again, don't assume everything will be free because you have insurance. Also, don't assume that a doctor's office already has your insurance information because you submitted it to the UF Health Compliance Office. It is best practice to keep your insurance card with you and show it every time you see a doctor. And make sure you are paying attention to any medical bills. We'll give an overview of the process here. Step 1. After you provide your insurance information to the doctor's office, they will submit a claim for services rendered to your insurance company. After that, the insurance company will pay according to the benefits outlined in your plan. It's a good idea to download the insurance company's app so you can keep tabs on the claims you have open. The app is great because it allows you to see any notifications from the insurance company that could delay claim processing, so make sure you pay attention to those. It will also show those pending claims, and of course, you'll be able to access your insurance card in case any medical providers need to see it. The app is a great resource, and we recommend everyone use it. After the claims are processed, the doctor's office may send you a bill for any remaining charges that insurance did not cover. Here is where we also recommend downloading your healthcare provider's app, which is where you can manage your bills. At UF, the Student Healthcare Center uses the MyChart app, which you will have access to after your first appointment. We understand that medical bills can be a confusing headache, but please watch out for them, especially as international students, because you don't want to have any unpaid debts in the US that could affect your financial freedom. Just like your health insurance is your responsibility, your medical bills are as well. And with all this information, we hope you feel better prepared to be your own advocate and have a healthy future in your academic career at University of Florida. The International Center is here to support you and get you connected with any services and resources on or off campus that you may need.